So let us first understand what quality is. Now, I would like to explain this to you with an example, non-healthcare example. Suppose you go to the market and buy a smartphone. Okay, that is worth 50,000 rupees. Now, when you have purchased it, you bring after purchasing, you took it to your home, right? When you unbox the phone, you realize after unboxing, when you switched on the phone, you realize that the phone's touchscreen is not working. So now we have to ask ourselves that whether we have received a quality product. The answer is clear no. No, we have not received a quality product. Now, this is a non-healthcare example. Let's move on to the healthcare example. Similarly, a patient visits a hospital with a simple fracture, right? Now, during their stay, the patient drinks the contaminated water supplied by the hospital, right? Now, patient develops severe diarrhea or gastrointestinal infection. Now, ask yourself, now we have to ask ourselves that whether we have provided this patient quality healthcare service, right? The patient came with what problem? The patient came with the fracture problem, right? And till now, that problem has not been resolved, but we have added one more problem. That is GI infection. Okay, so we can understand that yes, we have not provided the quality healthcare service to this patient. Now the question arises, simple question arises arising in my mind that can could this have been prevented? Uh, Hospital management could have done anything to prevent this situation from the patient developing GI infection. The answer is yes. Now, the next question that is coming to my mind is what actually caused this contamination? Now, I'll find the root cause for this. Now, what actually led to this contamination? Is the water coming from the municipal corporation was contaminated? First thing. Secondly, is my RO system faulty? Thirdly, is my municipal corporation water is not contaminated? RO system is perfectly doing fine. My water storage tank is dirty, right? That is a question. Like that, what was actually the what actually caused this contamination? Now, after investigation, we found that overhead water storage tank where the water was stored, that tank was not cleaned for 5 years or 2 years, whatever you imagine yourself, right? And because it was never cleaned, or it was cleaned, it was not cleaned for 2 years or 3 years or 5 years, whatever it is, right? Obviously, this will result in contamination of the drinking water. Okay. So what should a hospital do now? What should a hospital should do now? Obviously, they have to hospital should obviously the patient has to be treated for GI infection, but also apart from that, administratively they should also clean and disinfect the water storage tank immediately. Now that is fine. Now, suppose I am a hospital owner. Now I decided from today onwards we are going to clean it, this tank, every 3 months. Right. Now, please understand, I have made this as a standard in my hospital. Okay, now from now onwards, every 3 months, we are going to clean the water tank. Right. So now this we can call it as standard. And in the similar way, in a hospital, we can have multiple such standards. We're saying it as standard, right? Right. If I talk about NABH, Just similar to this, NABH has 639 standards, right? NABH will talk later, but moving ahead, the next question is, now fine, I have made this standard that yes, fine, from today onwards, every 3 months, after every 3 months, the tank should be cleaned. Now, how do as a hospital owner should ensure that this cleaning is actually taking place every 3 months? So the answer is monitoring system. I have to establish a monitoring system. How? What? So we have to prepare a water tank cleaning schedule. That means that on 1st of April, April it was cleaned. Now after 3 months, that means on 1st of July it should be cleaned. Now after 1st of July it should be cleaned after cleaned on 1st of October. That's how we have made a water tank cleaning schedule. Right. Now I have made a SOP also that this particular specific employee or that department is going to clean that. Right. I have to maintain a register. I have to maintain a register in which I will take it as like date, time, every date on which we have cleaned it. Okay. And like we have to keep this in the register, and some like supposedly we are given this responsibility to housekeeping to clean that, but maintenance will cross verify it, right? And we also can have geotagged photos of the cleaning, right? And I'll put all these documents in a paper that every time whatever the things are there, I have to keep and maintain a paper for that. So what will happen that now as a hospital owner, I can any day go and check these documents, these geotagged photographs that okay, it was actually cleaned, right? Now moving on.
Let's move on. The organization implements standardized handover communication during each shift, between shift, during transfer. So this is what handover means handoff. That means when a patient is shifted from emergency department to ICU, the nurse from the emergency department or the doctor from the emergency department will give the handover to the doctor, or nurse will give to the nurse. This is called handover, right? Handoffs. Let me tell you, a majority of medical negligence or anything, any wrong thing happening is during a wrong communication. The handover was not proper. Because of the improper handover, the patient has to suffer a lot of times, right? So this becomes very crucial in the patient care, right? So basically what should be done to to avoid this, that to avoid any kind of medical negligence, any kind of untoward event happening to the patient. So we should have a standardized handover communication, right? So when the standardized handover communication is to be done, uh, at the time of changing shift, the transfer between units, right? Now the next question is that what should be there in the standardized handover communication. Now this is called S bar or is bar, ISBAR or SBAR, right? I means identification, S means situation, B means background, A means assessment, and R means recommendation, right? So are we clear in understanding this, right? Look, I means identification. Sometimes it is ISBAR and sometimes we call it as SBAR. Right now, so I also we understand what is I. I means identification. So I will say that I am Dr. Aman and calling from the fourth floor or the medical ICU. Right. Now S means situation. Patient on post-operative care in ICU, stable condition, but respiratory distress notice, right? Then I will give the background of the patient. Background means under this patient underwent abdominal surgery with stable vitals but requires oxygen support. This is the background, right? Now the assessment would be oxygen saturation is low, right? This is the assessment, and the recommendation would be monitor respiratory function closely, right? So this kind of communication should happen between the handover, right? So ISBAR or SBAR. IS means identification. I will tell about myself first, who I am, then I will explain about the situation, then I will talk about the background, then I will talk about the current assessment, and then recommendation. Okay, so this becomes an important and a standardized tool. Now, once I have communicated to the other doctor, now the other doctor will read back or repeat back, so that or teach back also is there, so that it is clear that whatever I have communicated has reached in the same way, because this kind of communication error can happen a lot of times. So better is to have read back or teach back or repeat back, whatever we can say, to reduce the errors. Okay, so characteristics of a high quality handoff. Handoffs are interactive communication of patient information. Handoffs include up to date information regarding patient care, treatment and service condition, any recent or anticipated changes. Interruption during handoffs are limited to minimize possibility the information would fail to be conveyed or forgotten. Handoffs require a process of for verification in which we say it as repeat back, read back, or teach back, right? And the receiver of the handoff information has an opportunity to review relevant patient historical data, right? Which may include previous care, treatment, services, and all, right? So this is an important aspect. That's why it is a core. This is important because a lot of mistakes happen in this particular scenario. Okay. Now, do we have any doubt in ISBAR? This ISBAR is for every kind of communication you are having in the healthcare setting.
So the first standard is that the organization has a system in place to provide a safe and secure environment. And the objective element, the first objective element, there's a core element, is that the patient safety devices and infrastructures are installed across the organization and inspected periodically. Now, from the standard itself, you get the gist that they are talking about patient safety devices and infrastructure, as well as they are talking about inspecting them periodically. So within the standard, they talk about a few patient safety devices and signages that you must have seen across the hospitals. They have mentioned a few safety devices, although I've added on a few more safety devices that is common across hospitals. These include grab bars, non-slip mats, fire safety devices, including extinguishers and alarms, call bells, patient monitoring systems, wheel locks. And now in terms of signages, we have the radiation signages, wet flow signages, emergency exits. So what they have said is that all these signages and patient safety device should be installed, and some things out of this, like for example, the extinguishers, alarms, the call bells, all these require periodic checks and maintenances to ensure that they continue working as expected. So the objective elements expects that the organization does these periodic checks and that all these installed equipments are in good health. So the next objective element is a commitment that says that the organization has facilities for the differently abled. Now, by this, they mean that the organization should be inclusive in terms of the facilities they are providing, and that there should be provisions for the differently abled, be it the physically challenged, the visually impaired, or mentally impaired to access the facilities that are being provided by the facility. This, along with the standard requirement, is also a regulatory compliance in terms of municipal departments or the building codes that require that the facility has certain things. For example, that is like described in the standard, that there should be special toilets for the differently abled, and these should be the facility itself should be wheelchair accessible. Now, there is an accessibility standard for healthcare provided by the Government of India that can give you more in-depth information about what is expected out of facilities in particular healthcare organization, what they expect. Now, for example, if I show you an example of a differently abled toilet, you'll be able to see that it is much bigger as compared to a normal toilet, so as to accommodate maybe a wheelchair, and it has more space for the patient to move around. It has additional sidebar, it has a posterior grab bar. You'll see that it has a soap dispenser with a hand sensor, so that they don't have to press it, since their hand might be already grabbing a bar. And you'll also see that the door is much wider for the washroom, so that the wheelchair can get in. So this is just an example of a differently abled washroom. Additionally, the guidelines also specify that it should have a accessibility loading zone that can be for the wheelchair entrance and stuff like that. So these are described in detail within these accessibility standards for healthcare, so you can refer to that if you need more information on that. Next is, so moving forward, the first standard is that the organization identifies those who are responsible for governance, and their roles are identified. So the organization identifies the information needs of the patient, visitor, staff, management, and external agencies. So within this, it says that the organization will systematically identify information needs of the stakeholders. So the organization should be able to identify what information is required for what group of stakeholders. So for example, this information needs of the patient and visitors might be different from those of the staff. It might be different from those required by the management, and so on. So it also tells us there are different mechanisms through which the organization can gather what information is required by the stakeholder. For example, feedback forms, they can benchmarkings, patient calls can be done, group interviews can be done to gain insight into what is required by the stakeholders. Also, all this information needs to be formally recorded. Now, just to give you some idea about different kind of information needs of the categories, patient and visitors might require some kind of information on when the timings of the OPDs are. So you'll see posters like this or standees like this in the hospital telling them what the timings and dates and the location for the OPD appointments are. You must have seen a scope of services within the hospitals and outside the hospitals. That is another form of information that the stakeholders of patients and visitors require. You can also see the ward visiting timings, for example. That is a kind of information that the visitors look for. So coming on to the staff and management, the utilization rates of hospital beds, for example, or any kind of graph or any kind of statistics is something that the staff or the management might be interested in. Then coming to, especially for staff, hospital SOPs and policies is something that the staff looks for. So that is a kind of information need for the staff. Coming on to the general community, maybe if you're doing something for the community, like for example, even if you're expanding your hospital network or bringing on some new service, that kind of information is something that the community might need. So that is information that you will release for the community. And for example, external agencies, for example, the government agencies, that they might require you to notify certain diseases. That is a kind of information need for the external agencies. Next is